Welcome back to another episode of Light Beer, Dark Money. I'm Sean Noble.
I'm Chris Clements.
Here we are in D.C.
We are in the belly of the beast.
Well, you said that last time.
I know, but this is where it all happens. We're here with somebody who makes
that's the most important part. A lot of things happen here, yes. A lot of them bad. But if there's good things happening, there's a good chance that our guest, John Desser, is involved.
So how long collectively we know John David Desser?
Well, I mean, a lifetime.
A lot of years.
If it's
John's
collective.
been on our show remotely. This is his first time on stage, in person. And in D.C.
Mm-hmm. Correct.
So, JD, thanks for coming on.
It's a pleasure. You guys do a great job. I love the conversational way that you get into tough policy issues and patriotism, and you guys do a great job. So I enjoy watching your program, and it's fun to be on it once.
And I appreciate it. That's high praise coming from you.
Our viewers and listeners, I've known John since high school. We went to a little high school in Tucson called St. Gregory, which is now called the Gregory School for whatever inexplicable reason. And we did our internships up here. Yeah. Him with McCain, me with Ducini. It's been a very eventful summer up here together.
Yeah.
And then he came back after college.
Yeah.
Worked for McCain.
Yeah.
And he never left.
Yeah. But what's the most important thing about you, John, is that you have been here in what Chris calls the belly of the beast, but you haven't become swampified. I mean, you have kept your principles, you've kept your commitment to freedom from day one, and it's been awesome to watch your career as you've been involved. And so, for our listeners who don't know, John is like part of the movement of health savings accounts and providing more freedom to healthcare coverage, which has been near and dear to my heart, having worked for John Shattuck for many years. But man, you've really, how is it that you have been involved in this labor of love, as I'll call it?
Without getting stung?
Yeah, you've gone up against the big guys day in and day out. I mean, for anyone who has any doubts, big insurance companies do not like John Desser.
Well, I think I'll take that as a compliment. I think, one of your pillars is faith, freedom, and agree on something.
Free enterprise.
Free enterprise. And so faith has been the key for me, the touchstone for me to stay true to principles, as you call it, and not get sucked into the ways that Washington typically works. But I'm so glad you mentioned John Shattuck, because he was a real advocate for healthcare freedom and health savings accounts. And I had probably been battling in the world of health policy for a good 10 years before we really, or 13 years almost, before we started working on this concept of HSAs. Medical savings accounts, there was some discussion about back in the early 90s. And I will give credit to John Goodman, who's an economist from Dallas, Texas, who came to Washington, met with Bill Archer, drew a pyramid with a high deductible underneath and said, this is how healthcare ought to work, because you'll incentivize consumers to care about the costs, which they're usually distanced from and therefore aren't good shoppers of healthcare. And it'll create an incentive to save over time. Archer liked that and decided to try to add that concept to the Health Insurance Portability Act of 1996. And the best he could do was like a demonstration project. That's the only thing Ted Kennedy would accept.
Yeah, of course.
But that was the nose under the camel's tent, so to speak. So 96 MSAs get passed, so hat tip to former Chairman Bill Archer. I know his son Ren will be upset if I don't give him credit for that. Ren's back in the Trump administration now, serving as a counselor to Secretary Kennedy.
Oh, great.
Yeah, and so that was the first thing. But Goodman, was really the intellectual power behind that. Phil Gramm was very involved in those days. I worked for John Kyle after McCain. Kyle liked the concept. And then in about 2003-ish, a small insurance company at the time called Fortis Health, which was based in the district of a brand new freshman congressman from Wisconsin named Paul Ryan, came to us and said, these MSA plans are just too restrictive. there's all of these caveats and requirements, and we can't get enough of these out to the public the way we ought. And we have about 14 things we'd like to see fixed about medical savings accounts. I said, okay, well, write them up for me. And they gave me a list. And I organized a meeting with John McManus and Joel White, who are the two professional staff members at the House Ways and Means Committee. And I brought people like Dan Perrin and, some of the other advocates for conservative health policy and some of my other clients at the time. I was working for Tom Donnelly at the Jefferson Group. We sat down with McManus and Joel and said, here are our 14 ideas on how to fix medical savings accounts. John said, can I have a copy of that? I said, sure, and handed it to him. Then I didn't hear from them for 2 months. This was November of 2002. January of 2003, a bill gets introduced in the House of Representatives by Chairman Bill Thomas with all 14 things in there. And I thought, wow, that's amazing. And things usually don't go that easily. And then I started having an argument with them about including that in the last round of Bush tax cuts that we're going through.
I remember this.
And they kept telling me they weren't going to put it on the tax cuts. The chairman doesn't want to add it. I'm like, but it is a tax cut. Just add it to the... Nope, chairman doesn't want to do that. And I thought, why would he introduce a bill and then choose not to move it? It's frustrating. So, a couple months go by, and I'm not really seeing where this is going to go. And then I get a call late one evening in March from Joel White, who now runs the Coalition for Affordable Health Coverage.
Yeah.
And he says, hey, John, we're marking up the Medicare bill tonight. I was like, yeah, no, I wasn't that excited about the Medicare bill. Remember, there's a lot of concern from conservatives. Was it going to cost as much as CBO estimated or more or less? Turned out to be half of what they estimated.
Right.
But at the time, we were all worried about it.
Yeah.
And so he calls and he says, we're marking that up. I go, yeah, I know. And then he says, we're adding the HSA bill to it. And I almost fell out of my chair. I thought, I hadn't thought of doing it that way. Now I understood why Thomas didn't want to put it on the tax cuts bill, because he knew he might need it as a sweetener for conservatives for the Medicare Modernization Act. And he did need it.
Yeah, he did.
And that is how it passed.
That is exactly how it passed.
Well, and it's been a great blessing to a lot of families, a lot of people who rely on that for just some, either as a vehicle to pay for basic medical expenses or drug expenses, a whole slew of different things.
And preventative care.
And preventative.
I mean, and for me, that's the thing that I've learned over time, is that the preventative side is really the most important.
Yeah.
Because if you can stop yourself from getting to the point where you become really sick, that's where it gets really expensive.
That's
preventative
exactly
stuff
right.
is,
And now there's in the latest permutations of tax and Medicare and Medicaid, we're back at it again.
Yeah, we are, and which is exciting because ever since then, nothing really has been done to modernize
It just pretty much stays stagnant.
Yeah, so there's 35 million accounts in the country. It's good. My current employer, HealthEquity, services about 10 million of those. And so that helps probably 70 million Americans. But there's a whole slew of people on Medicare, Medicaid, TRICARE, VA, IHS, and a bunch of people in the employer market who don't have access to a high deductible health plan. And so how do we expand access to something similar to an HSA or HSAs themselves? So since 2016, when Kevin Brady was chairman of the Ways and Means Committee, they had a slew of HSA expansion bills that they wanted to pass. They got that out of the Ways and Means Committee, but it never passed the Senate. Last year, same thing, got out of the Ways and Means Committee, died in the Senate. Now it's part of the big, beautiful bill. So that was passed by the House a couple weeks ago. The Senate just needs to keep it in. Just don't touch it. And you'll probably get another 20 million accounts out of that.
Wow, that's tremendous.
Because they allow people on Medicare Part A to keep funding their HSA. It allows people with catastrophic or bronze plans on the exchanges to get an HSA, and allows catch-up contributions and some FSA rollovers and other things that'll make them work better for a lot more families. So we're very supportive of the HSA expansion that was done in the House, and we really think it's important for the Senate to keep it in. Not unlike back in the Medicare Modernization Act, where we were all thinking HSAs need to stay in for there to be enough votes to pass it in the House, and I think that may be true here as well.
yeah.
So
It's interesting how history repeats itself. or at least it rhymes, right?
This is a rhyme.
It's a rhyme.
It feels that way.
Yeah. But do you ever pinch yourself on this? I mean, you've been involved. I mean, it's not an exaggeration. This is your creation in many ways.
Well, I wouldn't take that much credit for it because I really think it was John Goodman.
Why don't you take that much credit?
Well, because John Goodman came up with the idea. Pat Rooney put a lot of money into it.
Yeah,
he was chairman of Golden.
But I don't think it's an exaggeration that you're the godfather.
All I did was notice a good idea, and then help get some people around it. And that's what I do well.
Sure.
I'm not an economist. I'm not John Goodman. I'm not going to come up with this idea. I don't have millions of dollars at my disposal, so I'm not Pat Rooney who's going to finance a whole movement. But I know how to connect the right people with the right people who have the right ideas.
Yeah.
And I feel like that's what...
That's tremendous, though. But that's a skill. That's an art.
Yeah, it is an art. It's
In this business, in this town, you learn from Mr. Donnelly that the relationships are everything. And you've done a great job of not only fostering those relationships, maintaining those relationships over time. You just, listed a smorgasbord of different people that you've connected to, through the course of your career. And now they're back in places of authority and power.
It's true. I was on the phone last night with John Goodman.
Yeah.
30 years later, and we're talking about how do we make these provisions better in the bill. And, he was the guy in 91, 92, 93 who convinced Bill Archer and sold it to Phil Gramm, et cetera. So, yeah, people stick around. Roy Ramthin, who was at the Treasury Department when the HSA law was passed, so he had to come up with some of the regulations to implement HSAs. He's still involved. He's a consultant to the HSA Council, which is a group that my company, HealthEquity, is a member of. And so he's still quite involved. And yeah, we celebrated the 20th anniversary of HSAs last year and had a small dinner with some people who had been involved for a long time. One of those people I have to mention was Grace Marie Turner.
Yeah.
And Grace Marie was an institution here in health policy circles.
No question.
Everybody knew her. Everybody loved her. Everybody was thrilled to be around her and interact with her. She just had a beautiful, pleasant spirit about her, and she could be tough on policy, but do it in a kind
way
and affable way. She passed away last week.
Yeah.
And so,
just a really sweet woman.
and I think there's a bunch of people in the health policy world who are going to come together and honor her next week at her.
Well, that's good. She deserves that. She really was an institution.
Yeah.
And a key part of what this movement has been all about
That's
for
right.
many years.
I think that's right. I don't know who it was, but somebody on social media said Grace Marie was loved by Republican committee chairmen because they knew if they could have her come testify, she would do it with compassion and a smile on her face and make it really hard for Democrats to dislike her or what
she was a great witness for our side. There's
Really
no
good.
question.
Yeah, she had an amazing spirit about her.
Yeah.
Special woman.
So, John, I mean, the HSA stuff, the Godfather, all that. But let's talk about something a little more serious. Not that HSAs are not serious, but I mean, the last time we talked, I can't remember when it was. It's been a while, but the rise of anti-Semitism is not slowing down. It's only getting worse. This attack that happened recently in Boulder, you had the killing of the couple here in D.C.
Who were messianic.
And that's one that hit really close to friends of mine. I mean, I'm friends with a woman in Colorado who's very close friends with the woman who was killed. It is horrific. I mean, the attack on on Josh Shapiro's home, the governor of Pennsylvania, he was Jewish.
Yeah.
What do people need to understand, and how is it the Democrats have not figured out the problem that they have on their hands?
That's a good question that I don't know the answer to, but I agree with the problem that you state and observe. It's astounding and confounding and confusing and scary to be Jewish in America, which is a crazy thought. Did you know that almost as many Jews live in America as live in Israel? So the diaspora used to be like kind of worldwide. It's really condensed into our two countries now. And you would have never thought that you would have to have any fear to be Jewish or come from Jewish heritage living in America. But I kind of feel like you do today. And that's very confusing. And I remember talking to a spiritual mentor and someone who I respect and admire, and asking him, how can you explain the response, an anti-Semitic response to October 7th? How does that even happen, right? Because you would assume there'd be an outpouring of support for Israel after something like that happened. And you can argue about the tactics in Gaza and all of that. Those are legitimate debates to have. But you cannot argue that those poor people in these kibbutzes and the people at the music festival were innocent people who were brutally attacked unprovoked. That you cannot argue.
Right.
Yes.
And yet it spurs anti-Semitism. Cannot understand that. And when I talked to someone, he said, look, you just got to understand, we live in a tipsy-topsy world where a lot of things don't make sense.
Yeah.
And this is just one of them. And it's a little scary.
It is the very definition of living in the upside down world. I mean, it just doesn't, because it doesn't make any sense. And the reaction to October 7th was so stunning in how immediate it became anti-Israel.
Right.
When Israel was the one that was attacked.
Yeah.
I mean, which tells you that the radicals have done a very good job of infiltrating universities, young people, social media. I mean, I saw somewhere a statistic about the number of pro-Hamas reels on TikTok versus pro-Israel is like 100 to 1, 50 to 1, whatever.
Yeah.
Just insane imbalance.
Yeah.
And to me, it just stares in the face of common sense, and it doesn't make sense.
It defies understanding.
Yeah.
It's stupefying. I was reading an article about the attack in Colorado last night, and did you know that one of the men who was attacked in that incident was a Holocaust survivor?
Yeah.
Can you imagine surviving the Holocaust and then being attacked on American soil by someone who's here not legally, I understand, and thinking you have a right to free speech, a right to voice your support for hostages that were taken, innocent people who were taken hostage by terrorists, and for that you get physically attacked and harmed. That's a new level of messed up.
Yeah.
There's a sentiment that I've heard from a number of commentators, and it's becoming more crystallized, and that is, when the enemy says to globalize the Intifada, you need to believe them. And unfortunately, that seems to be what's happening here.
Exactly.
And we need to be aware of it, and we need to fight it.
Well,
And to your point, the Democrats are deferring on a lot of 80-20 issues where this would be easy wins for them, but they won't because of a constituency that is pro-Hamas, pro-terrorist.
Yeah, that's the bizarre part, right? And so I was talking with some friends yesterday about where does the Democratic Party go from here? And, I come from the Al Fromm school of the Democratic Leadership Council. We're pro-growth, we're pro-business. I mean, the most successful, arguably, in our lifetime or post-World War II, however you want to put it, Democratic administrations was the Clinton administration.
Right.
And one of the reasons they were so successful is they co-opted a large part of the Republican agenda.
They did.
They were for cops on the street, balanced budget, welfare reform.
Right.
I mean, all kinds of things that Newt was for.
Yeah.
And so that was very clever on their part. And I can't imagine how they return to a governing party without moving back to the center. I just don't know that there's enough bodies in this country who support the radicalization that we've seen take over elements of the Democratic Party to get someone into the White House again. And so, or to have majorities in Congress. So I don't know how this is going to play out, or who the people are that will lead this. But I can't imagine moving to the center is not going to be required.
Well, and when you look at where the center of gravity is within the Democratic Party right now, it appears that it's Bernie Sanders and AOC.
Right. Yeah.
That with their,
They're the loudest.
Stop the oligarchy tour, and I mean they are the ones who are seen as the leaders of the party. It's not Chuck Schumer.
Yeah.
It's not Hakeem Jeffries.
Yeah.
And certainly not Kamala. So there is I mean, if that's their future,
That's problematic.
that's problematic for them.
Did you
And
guys
it's
see that?
problematic for the country.
Did you guys see that Gavin Newsom did an interview with Turning Point?
Yeah, with Charlie Kirk.
With Charlie Kirk. And he was already moving and said, now let me just tell you, I've met Gavin Newsom. He is a gifted politician.
He is.
And he's smart and he's affable and he's well spoken. And if he wants to move to the middle, if there's anybody who could pull off a far leftist agenda in California and record, but then move to the middle, he could probably pull that off.
Yeah.
But I feel like that's what's going to be required because I just don't think there's enough votes on the far left.
There aren't. And it will be interesting to see, who kind of comes out. Does Kamala run for governor, or does she try to reinvent herself to come back and run for president? I don't know.
That seems unlikely.
I don't see it.
I don't see it.
I could see Gavin making a run, maybe someone like Shapiro. There's got to be some executive from a state who knows how to run a state, run a thing that is practically minded about how to support economic growth in their state, is pragmatic about the role of capitalism and market competition, right? You have to have that experience. A senator or congressman might not be able to do that.
Right.
But someone who has practical experience running a state, realizing that you have to have a balanced approach to taxes and regulation if you want to have economic growth and prosperity, I think that's what's going to be required.
I do believe that's true for the Democrats, is to be able to come back in any kind of form of success. The question is, can someone like that get through their primary process?
Yeah, that's a legitimate question.
And I think that's.
Let me give my Democratic friends some hope. Okay, ready for this? This will blow your guys' mind. It's 2019, and it's the race. It's the Democratic primary race for president. And they're having these debates, and there's the 8 people on stage and all this. And there's a question that comes up, one of the early debates, it might have been the first debate. And the question is posed, raise your hand if you support Medicare for all. Every hand goes up except one, Joe Biden. And I remember turning to my wife at that point and saying, that's how he loses the primary. He will not be the nominee because he didn't raise his hand. The Democratic Party is for Medicare for all. He's an outlier. He's not going to win the primary. And what happened? Somehow he won the primaries. And so I think that's an example of where we assume, because of all of the attention given to AOC and Bernie Sanders and how loud they are, that that's where the majority of the Democratic Party is. But it might not be true.
Yeah, that's a good point.
Well, and then you had another person on that stage. She's now head of national security for our country. That's right. Yeah. And then you have a lifelong scion of a Democratic family who's running HHS and in support of all the things you're working on.
Incredible.
Who would have thought?
Incredible. I had a chance to get to know Callie Means, who kind of is the person who connected Bobby Kennedy with Trump. Do you guys know this story? I mean, it's been published in the New York Times or whatever, but it's a really fascinating.
Well, let's tell her. For our listeners,
Callie, I think, met Bobby through Tucker Carlson.
Yes.
And because somehow Callie and Tucker grew up together, and somehow Tucker was intrigued by Kennedy, maybe had him on his show, and then put the two of them together because they're both talking healthcare and stuff like this. And so they developed this relationship, and Callie's thinking about when will the moment arise, and will it arise, where it makes sense to put Bobby and Trump together. And he's kind of waiting and waiting and waiting, and it doesn't look like it's happening just yet. And Bobby's running against the party establishment and has to run as an independent, and it's just all playing out in a very interesting way. And then there's the assassination attempt in Pennsylvania. Okay? And Callie describes it as a spiritual epiphany, where he feels like the Holy Spirit spoke to him and said, this is the moment. And he calls Bobby and he says, this is the moment. You should call Trump tonight. Now, who better to call a president who's just been through an assassination attempt than the son of the attorney general who was assassinated, and the nephew of the only president of the United States who was assassinated in recent memory. Right? They couldn't relate to this.
Yeah.
Nobody else can.
Nobody else can.
And he calls Trump, and apparently they have a good conversation, and that leads to the next conversation, and then they decided to team up.
Well, you can make an argument that the Maha movement got Trump elected.
I think it
I
helped.
think
Yeah,
absolutely.
no question. It was a
massive
huge
piece
part
of
of that.
And to your point about Tucker's relationship with Bobby, I remember his first interview with Bobby, when he was promoting his book, The Real Anthony Fauci. And I'm listening to it. I texted Tucker. I go, "This cannot be real." He goes, "It's all real, and it's all scary." And it was amazing.
This is Kennedy has a book called The Real.
Real Anthony Fauci. It is like 500 pages. It's really well researched. It's everything that he outlines in the book. You know, if it was untrue, Fauci could have sued him.
Yep.
Didn't sue him. Not for one word. And after that, his trajectory within conservative circles and also within the party changed.
That's really interesting. You know, I had a chance to attend the Maha Commission report unveiling a couple weeks ago at the White House.
That's right.
And really interesting. And, you know, I'm not a conspiracy theorist, and I think vaccines are generally speaking a good idea. But there's some statistics that were shared in that commission report that are just, you just can't ignore. The rates of pediatric cancer, the rates of obesity among kids, the rates of diabetes. This is a problem in the industrialized world. It's not a problem in Africa. How do you explain that? And so when I think about this issue, and again, I don't have an axe to grind here, but when I think about it, if you study a water bottle and the contaminants in the plastic, and you determine that the amount of toxicity is so low it will not harm a human being, and therefore you approve that product, that's in isolation of everything else we're exposed to in our society.
Right.
And I think if there's one thing the Maha Commission report suggests, it's that we need to look at all of the things to which we're exposed. It's not one thing. It's not just vaccines.
Right.
It's what's vaccines in the context of everything else we're exposed to, and in our food, and in our water, and in the soil.
It's vaccines and how they interact with the chemicals, with the with the processed foods, with dyes, with whatever.
Exactly.
It's the environmental factors that have not been. I mean, it's interesting. If we were to go back, the Republican Party has been the party of conservation traditionally.
Yeah.
And
Teddy Roosevelt.
Yeah, Teddy Roosevelt. And so if we were to, I feel like maybe we're swinging back that way a little bit, and trying to understand a little bit more about, hey, all this processed crap, all this toxicity, all these chemicals, this is not necessarily good stuff.
And Teddy Roosevelt also was for the working man, which is an interesting thing that we've now dipped our toe into. But what was interesting at that Maha meeting was Steve Miller, who's, I guess, the deputy chief of staff now for policy. I always think of him as an immigration guy.
Right.
Which he is. Yeah. But apparently his portfolio has expanded quite a bit. But what he said there really, really struck with me. He said, we have to understand what's different about today. He said, Bobby Kennedy has been issuing reports on American health for a long time, probably decades. What's different about this report is it has the United States seal on it. And I think that was an interesting observation that Stephen made. And I don't think anybody's out to get anybody or any particular industry, but the sheer statistics suggest that an honest study of all of these things needs to be undertaken. I think that to me is the main takeaway of the commission report, and I hope the government is able to begin to do that. And it seems like that's what Secretary Kennedy wants to do.
Yeah. We certainly don't need FDA commissioners heading over to Big Pharma anymore.
Yeah. Right.
And those type of conflicts.
Yeah.
Well, John, thank you so much for
being
here.
Thank you so much. It's always great to be with you.
We can just keep going. But
yeah, we could.
Give other guests. No, it's great to be with you guys. Thanks for what you're doing. I think it's educational, it's fun, and it's uplifting in our
thank you so much for your friendship all these years, all these decades. What I failed to mention is that he's also a godfather to my sweet daughter,
Yeah.
Campbell.
That's great.
Good to see you guys.
You too. Thanks so much for being here.
Thanks for listening.
Take care, everybody.